Thank you and welcome. My name is Julie Rogers. I am the Kalamazoo County Board Chair, and we have an important update on the current situation in Kalamazoo County. We have several different leaders representing different agencies. With me is Vice Chair Tracy Hall, Sheriff Rick Fuller, Tracy Morad, our Administrator, and our Public Health Officer, Jim Rutherford. We will start with Jim Rutherford giving us an important update on the COVID-19 coronavirus.
Thank you, Commissioner Rogers. We want to make sure that residents are aware of the fact that this is a very quick-moving, rapidly evolving situation. We're striving within all of county departments to make sure that our community is up to date and that they're getting information as soon as we get it. To date, we have sent out 16 COVID tests to the State Health Department. 2 have come back negative. We're pending results for 14 samples. Currently, this process involves local health departments in the state approving the samples that are submitted to the state lab. That may change when the private sector begins sampling COVID samples that are submitted. It's important to know, and we've chased down a lot of false information as it relates to positive COVID cases. It's important to remember we do not have a positive COVID case in Kalamazoo County. Local health departments will be notified of all positive cases moving forward, as well as any negative cases. So anything that you hear would be false until you hear it from local public health. We continue to send our messages out through the media, Facebook, and providing a lot of community updates. There's been a lot of discussion relative to medical supplies. We're working in unison with our partners at the national level, at the state level, and in unison with our partners within the emergency rooms, local doctors, and our family health center to assure that we have supplies and that they are using them correctly. In terms of bars, restaurants, there's Executive Order 2020-5, which came out from the Governor's Office, did cancel all events and presents assemblages of any event over 200 people and 250 people in attendance. We're hoping that this gets adapted to change the order, allowing for 50% of the overall capacity with no more than 250 maximum. We should know about that sometime tomorrow. Our staff are physically going out and working with our restaurants and our bars to make sure that they understand the current status of the executive order. I'm going to turn it over to Tracy Morad, who's going to talk a little bit about county operations as it relates to services.
Thank you, Jim. A little bit about how we are bringing information to the community. We've updated our Kalamazoo County Government website. That's www.calcounty.com. We have created information that can be accessed regarding COVID-19. We have the CDC, we have the state and our local information on that website, which is now accessible to all. We also have created an essential questions portal on the front of the website, where if the community cannot get questions answered in other mechanisms that they work through that essential function question portal, we will then be shipping those questions to the different department heads and agencies to get you those answers. Also internally, we are very compassionate for our employees. We have enacted what we call the cautionary work period. That cautionary period starts Monday and goes through April 12th. This allows our employees to, while they are home, to be paid through a policy that was created by the Board of Commissioners. We will be providing essential functions and ensuring that all services are provided to the community through our staffing model right now. Also, to let the public know that starting Tuesday, we will be restricting access to county buildings. As I stated, with essential services being provided starting Tuesday, there will be ways to contact us to get primary services complete. With that, our health office remains in full capacity to serve essential functions. And our public health officer will be explaining how his model is outlined to deal with this health crisis.
We'll continue to work in unison, again, with all of our local partners, state and federal partners as well. Our doors will remain open, our clinics will remain open. We continue to urge people that if you feel that you need to get tested for COVID, you reach out to your primary care doc. If you don't have that, then you can contact the emergency room. We aren't recommending that people go down to the emergency room. We're trying to make sure that that doesn't get overwhelmed with people that worried well and people that are symptomatic with other more common illnesses such as seasonal influenza. For the call-in center is 269-373-5267. We want to continue to remind people we're encouraging social distancing. Many of you have heard of that. This is basically, if we're effective, the more social distancing that we do, we're effectively trying to flatten the COVID curve that many of us talk about. Stay at home if possible. If you think that you've been exposed to COVID-19, again, call your healthcare provider. If you don't have a provider, call the hospital. Do not go down to the hospital. Call them first. We're not encouraging people to visit the ER. Wash your hands often with soap and water for at least 20 seconds. If hand washing is not an option, then use sanitizing solution. And again, avoid touching your eyes, nose, and mouth with unwashed hands. Remember, folks, this is an attempt to try to prevent and mitigate further transmission of this disease. It's important that people take heed. A lot of people think that they're not going to be infected by it. In the younger population, I know a lot of you think that you're invincible and that you won't get symptoms, but you can be a carrier. And we have to think about our grandparents and our elderly population to try to protect them because they're very vulnerable to this particular virus.
So as of this last Friday the 13th, the Kalamazoo County Sheriff's Office, the Emergency Management, opened up the emergency management operations. We've activated our center as a response to the COVID-19. In accordance with the Governor's declaration of a statewide emergency with regards to the COVID-19 outbreak, the Kalamazoo County Sheriff's Office Emergency Management is acting in a logistical and communications coordination role. Law enforcement stands ready to assist all within our borders to take care of the emergency situations that they may have and respond appropriately. We work as a community. We are Kalamazoo strong, as we like to say, in the emergency services field here in Kalamazoo County. We work with all of our local partners and we share resources. So again, there's going to be plenty of opportunity for us to interact with the public, and we ask for your patience when we're out there working with you in any of these situations. And now I'll turn it over to Vice Chair Tracy Hall, who has further information.
Thank you, Sheriff. We know you're worried. This is a very taxing time for our county. Please know that our county officials are working incredibly hard right now. I'm asking you to look out for our most vulnerable populations during this time, which include our elder community and those with chronic illnesses. People with pre-existing mental health conditions should continue their treatment and be aware of any new or worsening conditions. Everyone reacts differently to stressful situations, and we need to remember to take care of ourselves and to take care of others. Remember, here's a reminder that Kalamazoo Public Schools has set up an emergency food distribution. Please check their website and Facebook page for more information. If you need any other support beyond health-related needs, please call 211. Let's fight this public health concern with compassion and science, not fear and discrimination. You cannot tell someone has a risk for spreading COVID-19 or any virus by the way they look. And we're in this together. We're going to get through it together.
I want to take the time to thank our entire community. You have essentially changed the way of life and taken extraordinary measures to help protect the health of our entire community. I know this has not always been easy, and I recognize that. There have been challenging decisions made, and those decisions may have provoked fear and uncertainty at times. Rest assured, the actions you're taking are in the best interest of public health and public safety, and for all people residing in Kalamazoo County. I am thankful for the seriousness you are taking in your actions and the continued effort you are making now and in the coming days. Please continue to join all of us in following both the governor and our public health officer's recommendations on social distancing, frequent washing of hands, and staying home if you are ill. I encourage you to watch our next Kalamazoo County Board of Commissioners meeting at 4 and 7 p.m. on March 17, this coming Tuesday, online instead of joining us in person. It will be streamed as usual on PMN's website as well as our very own www.calcounty.com. As a healthcare provider, I would also like to thank our first responders, hospitals, physicians, medical providers, and of course our public health staff. You are all doing an incredible job during this public health outbreak. These systems are being overwhelmed with people stopping with sometimes minor respiratory symptoms. We want to alleviate the burden that is being put on our healthcare system while protecting the health of those healthcare workers who are working tirelessly. Let's all be good stewards of our limited resources and the testing supplies that we do have. The advice you are hearing today, unless you are severely ill, is that you should call your doctor's office before showing up. Thank you so much for joining us, and again, know that there are many resources throughout Kalamazoo County, and we are here to serve you.